Hi, my name is AFIFAH from Group B A235 and I would like to explain about obstetrics and gynecology. Obstetrics and gynecology is a medical specialty that deals with women's health during pregnancy, childbirth and the postpartum period, and also includes the diagnosis and treatment of disorders of the female reproductive system. Obstetricians focus on prenatal care, monitoring pregnancy progress, managing complications, and providing postpartum care. Gynecologists, on the other hand, diagnose and treat disorders of the female reproductive system, such as menstrual problems, hormonal imbalances, pelvic pain, infertility, sexually transmitted infections, and cancer of the reproductive organs. Both public and private healthcare providers offer these services, with public services often subsidized or lower cost, and private services typically offering a wider range of options and personalized care.
Hi, my name is NURHIDAYah BINTI AJAH and I will be present about obstetric and gynecology supply and trends. The number of obstetric and gynecologists, which is ONG specialists, per 10,000 population in Malaysia is 0.32 in 2018, which is far behind when compared to other selected high-income countries, which is 1.58. The growth rate of specialty increasing 3.2% from 2014 to 2018. However, it shows that ONG specialty has the lowest growth rate compared to other health professions in Malaysia. ONG specialists also being distributed by region. As you can see, the West Coast region has the highest number of ONG specialists per 10,000 population than another region in Malaysia. For the second highest in number of ONG specialists per 10,000 population is in Sabah, followed by East Coast region and Sarawak. In Malaysia, we need to distribute the healthcare workforce in two sectors, which is public sector and private sector. As for ONGs, only 38.3% specialists in public sector, while in private sector, they have 61.7% of ONG specialists. The growth rate of ONG specialists in private sector increased to 17.1% from 2014 to 2018. The age below than 30 years old specialists are mostly found in public sector for each category of specialists. Same goes with ONG specialists, where in the age of 30 to 39 years old is based on public sector. However, the percentage of ONG specialists in public sector decreasing as their age increased. By the age above 60 years old, majority of the ONG specialists are in private sector. As for gender distribution of ONG in 2018, male doctors has a slightly higher than female doctor. Based on human resource for health country profile 2050 to 2018 provided the statistic where male doctor cover 53.3% of ONG specialists, while these specialists contain 46.7% female doctors.
Hi, my name is NAZMI bin SUHAIMI and I'll be present about the issue of obstetrical and gynecology in Malaysia. There are two main issues that I consider as hot issue regarding to ONG, which is the shortage of specialists in the healthcare system and burnout amongst the practitioners. So let us take a deeper look into the first issue, which is the shortage of specialists. When there is a shortage in specialists in ONG, it will lead to a lack of obstetrical care. This is really worrying because when a pregnant woman is lacking of obstetrical care, it can lead to complications during pregnancies, for instance, such as diabetes and high blood pressure. This issue is even more worse in the rural area that do not have access to the specialists. For instance, this is what happened in Sarawak. According to Sarawak United People Party, the amount of specialists in their place are 18 times more or less if we wanted to compare with Peninsular Malaysia. Furthermore, this shortage of specialists will also lead to a longer waiting time. When there aren't many specialists that can deal with the patient will need to wait for a longer time period. Let's move on to the next issue, which is burnout amongst the specialists. Burnout can be defined as a phenomenon that occurs when one person could not handle or manage their chronic stress. According to a study, 1 in 4 doctors in Malaysia are suffering from burnout. There are many reasons why burnout could happen towards all these specialists To name a few, it is because of heavy workload, lack of rest, and high stakes, which means they all need to carry a big responsibility on their shoulders. Issue of burnout amongst the specialists and all the healthcare practitioners are really something that we really need to look up to, because it will lead to many other issues. Someone that experiences burnout could change their character drastically, and most of the time it will also interrupt their work, and it is also really worrying for the healthcare practitioner.
Hi, my name is NURUL SAFWANA binti HAMSAN. Now I will present about ways to overcome the issues. According to the issues that have been raised, the first concern is associated with the lack of obstetrical care. It deals with the issue of a specialist scarcity that impacts not only obstetrics and gynecology, but other professions as well. Even worse, people in rural areas are considerably behind on this health knowledge. Therefore, based on the nation's health minister, Dr. Zaliha Mustafa, there is a solution to these issues. She suggested increasing the Ministry of Health's training opportunities and contracting out the rehiring of former medical professionals. This approach will expand the number of doctors and other medical professionals working in the field of public health and maximize the needs for experts in the nations. She additionally urged Malaysian experts who were living and working overseas to come back and assist their native nations. The second concern also touches on subject of burnout. Since healthcare personnel deal with various patients, poor stress management can lead to more severe and chronic stress. Specialists are encouraged to drawing boundaries between work and personal life, limiting the numbers of hours you work, taking frequent breaks, and scheduling downtime are all ways to prevent burnout in obstetrics and gynecology. This is because mixing personal and professional matters at the same time will exhaust our brains and make it impossible to think clearly and sanely. Even worse, excessive stress and overthinking can cause mental disease and make the heart beat quicker. Another method to reduce burnout is getting help from loved ones, close friends, and co-workers. When there are people around us who are always there to support and assist us, we will not feel alone, sad, or depressed. To ensure that the treatment given to patient is effective, specialists are urged to look after themselves before assisting patients.
My name is SYAZIRAH and I'll be presenting the conclusion of our topic assignment. The lack of obstetric and gynecology (ONG) professionals in Malaysia restrict obstetrical care and reproductive health services, especially in rural areas. The increasing number of pregnancy complications highlight the urgent need for treatment. Burnout among ONG specialists affects patient care and relationship among the healthcare personnel. To address this challenge, the government should focus on increasing the number of ONG specialists. This can be done by enhancing training opportunities, rehiring retired professionals, and encouraging specialists abroad to return. It is important to emphasize the value of rural healthcare and ensure equal distribution of specialists. Preventing burnout requires policies that support work-life balance, time restriction, and support network for medical personnel, ultimately improving patient outcome and job satisfaction. To sum up, to address the issue of burnout and the shortage of ONG specialists, the government, healthcare organization, and healthcare professionals themselves must work together. Malaysia can deliver through obstetrical care, protect its population's reproductive health, and promote the well-being of its healthcare workers by assuring an adequate and motivated workforce. That's all from us. Thank you.